Hi, welcome to the lung page. Today we are going to see a rapid revision of the chest X-ray 5 images in 5 minutes. This is part 4. So first case, 40-year-old female presented with fever and constitutional symptoms for 2 months duration. So we took a chest X-ray. So in this chest X-ray, as we all know, with the ABCD order, airway, bones, cardiac contour, diaphragm, everything is normal. So where's the abnormality? Where is your lesions you can find? So when you see this chest X-ray, everything is normal, but you can see here there is a white color streak line is there above the heart border, and also you can see here also above the heart border there is a white color streak line is there. So what is that? For further confirmation, we took a lateral view. So you can see in this lateral view there is a very nice pericardial rim is there, right? So this is called pericardial calcification. So we all know what are the causes of pericardial calcification in our setup. Most common cause is TB. So we have to exclude the TB. So here the diagnosis is pericardial calcification. So for the confirmation, we have to do the 2D echo or cardiac MRI or biopsy. So this is the first case. The second case, 40-year-old male presented with fever and cough for 1 week duration. So what is this chest X-ray? We all know this chest X-ray. In the finding is here, right side upper and middle lobe there is a cavitated lesion with air fluid level is there. So this is called lung abscess. Okay, it's very simple. Another case is 25-year-old male presented with chest pain and difficult to swallowing for nearly 1 year duration. So we took a chest X-ray. What is the chest X-ray finding? When you see this chest X-ray, airway, bone, cardiac contour, everything is normal. When you see this mediastinum, so there is a mass-like lesion is there. With that, some corrugated appearance. Cardiac contour is normal. So what is this? First differential diagnosis we have to think about, this is mediastinal mass, or sometimes any other lesions obstruct the thing. So here is a diagnosis. You can see these are the food particles going up to here. With that, here is a fluid level is there. This is called eclasia cardia or dilated esophagus. So we took a lateral view as well, and also further confirmation we have to go for the barium cello. Another case, 30-year-old male from the ICU. We took this chest X-ray. So the patient intubated. What are the possible findings from this chest X-ray? You can see with airway, bones, cardiac contour, ABCD order, everything is normal. You can see in the right side upper lobe there's a homogeneous opacity is there. With that rib crowding is there. This diaphragm is tented here, and also you can see middle lobe fissure is going elevated. So this is called right side upper lobe collapse. This is called golden S sign because of this elevation of this fissure. Okay. So another last case, very interesting case. 50-year-old male working in the stone cutting yard for 15 years duration, presented with cough and shortness of breath. So what is this chest X-ray? When you see this chest X-ray, obviously there's a lesion in the mediastinum. You can see there's a calcified lymph nodes are there in the mediastinum. Also, you can see some fibrotic changes in the upper lobe with elongated hyperinflated lung. So what is your diagnosis? According to the history, the most probable diagnosis is silicosis, because this calcification called eggshell calcification. So what are the other causes of eggshell calcification? Is another important cause is sarcoidosis. So when you identify this mediastinal lymph nodes are there, so bilaterally with eggshell calcification, first differential diagnosis is sarcoidosis, second is silicosis. So in here the diagnosis silicosis according to the history. Okay, so thank you very much. So this is the end of the part 4 of the rapid revision. Bye.